Good morning, BGI. Jeff Salo, your chiropractor of the group. And because this is a networking group, I thought I would talk today about how to train you, if you will, or educate you on what I do, some of my procedures and protocols, so that you have more of an idea what chiropractic does and what you're looking for out there in the public and the people that you meet every day, to see if maybe you can get a referral for me, or help them, more importantly, because you help them, they help me, everyone helps each other. It's all a good thing, and that's why we're all here. So my normal procedure and protocol goes as follows. Once a patient has been identified and wants to come into the office, they call and make an appointment. We set them up. It takes about 45 minutes for your first visit. You come in, you do some paperwork. Then we'll take you into a room. We'll do a thorough consult and history. That little 8-minute session is probably one of the most important sessions for me as a doctor, or any doctor that's diagnosing a patient, because that's your blueprint. When you come into any doctor, that's your blueprint when he's asking you questions about what's wrong with you or why you're here in his office today or her office today. So that gives them an idea of where they're going to start their workup and where they're going to go. We go into a detailed history. That's, again, your blueprint. We want to find out where you're coming from, what you've been doing for the last 30, 40 years, and why do you have the symptoms that you have. What makes me different from another chiropractor is I'm more of a corrective care doctor versus a pain relief doctor. A pain relief doctor is you come into the office, hey doc, I've got a headache, he adjusts you, you pay your office visit, you leave, he tells you to come back when you get a headache again. Okay, that's a good way to practice, you're helping the patient. But I like to take it a step further and say, listen, how would you like it if you didn't have headaches anymore at all? I can't guarantee that, but that's what my goal is. That's what corrective care work does. What we do with that is we assess the patient, we find out their history of what kind of problems or symptoms they've had, and I write up a protocol for them to come into the office multiple times over a period of time, and that's kind of a workup that we do for each case, and then we present that to the patient to let them know, this is, if you want to get rid of this problem once and for all, or for the major part of it, this is what you need to do. My job is to tell you what you need. Your job is to figure out what you want. Okay, so that's the difficult part about the business. What you need, what you want, or what you can afford can be two different stories. And there's two reasons why people do or do not come into the office: time and money. We'll talk about that in a minute. So after the history and the consultation, we get into a thorough exam. I do a neurologic, orthopedic, chiropractic exam, muscle testing, sensory testing, range of motion testing. It lets me know what you can and cannot do in the exam room, so I can assess further and match that up to your symptoms that you've told, written down, and given to me or to the doctor. After the exam, we determine if we want to take x-rays. X-rays are determined by the exam and the history. For legal purposes, I've done it both ways over the years I've worked, taking x-rays and not taking x-rays. X-rays aren't necessarily a protocol you have to use, but it's very good legally to protect yourself and the patient, okay? For the most part, there's usually not a problem because you're coming in with a pretty mild condition, and if I know you or understand the situation, we can maybe bypass the x-rays. Under a personal injury case, we would never do that, and my lawyer here will tell you that about you, so. You need to protect yourself at all times, and plus I want to keep working for a while, so I like to keep my license. So we will take x-rays after we do the exam. At that point, I will release you from the office. You are done for the day there. That's 45 minutes. I need to spend the rest of the day, night, evening, and next morning going over your case with a fine-tooth comb, looking at those x-rays and your exam and your findings and your history to find out what's the best protocol for you and what kind of care do you need. When you leave, we make a second follow-up visit. It's called the report of findings. You come in and you don't need to fill out any more paperwork. All your stuff is done. You come in and you come into our office. I will sit down with you. It takes about 15 minutes. We will go over your case in full detail. I'll rehash out the symptoms that you're having. We'll explain the exam findings that we have found. We'll go over your x-rays and show you what's normal and what's not. Believe it or not, when we do that and we do take the x-rays, unfortunately, I can show you an x-ray of a dog and you wouldn't know any difference, okay? But the point being is, you know, ethical and honest, I show you your x-rays, I show you normal, and I show you you. Every single time I do that, the patient says, that's me? If I could unzip you and show you inside your organs, your tissue, your skin, and your skeleton, you would definitely, without a doubt, change your lifestyle. There's no questions about it. But because we don't see it and we don't feel it until it hurts, we abuse it or don't take care of it like we should. Okay? So it's very important that we kind of pay attention to what our body's telling us. A lot of times we just, that's your thermometer, barometer, whatever you want to call that. That's telling you there's something wrong. Don't ignore that when you get that symptom, especially if it's a pain symptom. So in reported findings, we're telling you all your details. Then we get to the fun part. We talk about, after recommended care, we talk about your financial plan. Everyone goes, well, how much do you charge? How much do you charge? Is there anybody here from the chiropractic board? Okay. No. All right, good. We charge $1 million. No. I have to have a base fee. Okay, it's $50 for an office visit, but that's not necessarily what you pay. That's kind of confusing to people because here's the deal. We have different type of cash plans if you're paying cash. Some have insurance and some are personal injury. We'll get into that a little bit. But if you're on a cash plan, I'm telling you, you need 10 visits over the next 10 weeks, guy. And this is how we're going to break it down. Normally that's, whatever 10 times 50 is, and we give you a discount if you pay for it like a membership charge. Sometimes we'll do it like a gym membership. You'll pay a monthly fee because you're going to be coming in all the time under a maintenance program. But in the beginning, I'm confusing you. We do have a fee, but it's my job to make it affordable for you to come into the office. Like I said, time and money is the reason why people come or don't come into the office. Time, I don't have no control over. That's your priority of how you want to put your time. People go, oh, I don't have time. Baloney. You have time to do anything you want. It's a priority what you put into your day. The money part is where I can play with you a little bit to make it affordable for you. If I can't make it affordable, I don't see you, you don't get well. It's a lose-lose situation. So I can't stand there and go, okay, I need your $1 million and we're going to fix you up. It's negotiable of what you can afford, what you're willing to do, and how committed you are. Under insurance, unfortunately, insurance doesn't pretty much cover chiropractic anymore because it's called an elective care. They consider it not reasonable and necessary for you to get elective care. If you broke your back and needed surgery, they would pay for you in a minute, $25,000. But if I ask for $2,000 for the insurance company to prevent you from getting that surgery, they'll just say, prove it, he doesn't need it, and I'm sorry, no, denied. Pretty sad how our system works. We used to have coverage in 1980 when I started, and it was beautiful. Everybody could go into the office and get covered, use your insurance, you pay for it, and it's all said and done. 1990 that changed, and it changed the whole world and the healthcare. And then HMOs came in and blah, 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 blah. You can talk to Crystal about that. And I've always said, if you don't know what you got in your insurance, please talk to her because so many people come into the office and go, hey, I want care, I have insurance. You don't have coverage, you might have insurance, but you don't have coverage for chiropractic care. So it's kind of a tricky situation. It's my job to juggle the numbers to see if I can't make it affordable for you. We do auto debit, we do monthlies. If you're on a personal injury, it's on a lien, and my lawyer will make sure that I get paid. After that, then you decide if we want to go in. If sometimes you're not really decide if you want to take the care or not. It's a little overwhelming. You're like, what? 3 months of this, 2 weeks of that, this much, this, that. So we adjust you we offer you to be adjusted the first office visit, an office visit fee. When you come in for your second adjustment, you can tell the girls or me what kind of plan you've decided if you want to come into the care and be a practice member. So it's very negotiable with that. I try to make it work as best as possible with you without starving. After your adjustment, we put you on a spinal later. If you like, we have therapies. I'm more of what we call a straight chiropractor. I'm more into the spinal adjusting, the body adjusting. We do therapies of ultrasound, E-stim, roller therapy, trigger point massage. If you do massage, that's Will's job. But we do offer that in the office. We are now opening up, starting January 1st, a detox program, which has been excellent to go over. We've been working on it for about the last 6 months. We've done nutritional counseling, which has been a huge success in the office. Very, very easy to do. A lot of people, especially the first of the year, want to lose weight. All we're doing in the classes that we do there is it's almost like a weight loss challenge. You're showing up for 6 to 8 weeks, one time evening for 30 minutes, and we're doing a class on how to eat. It's that simple. It's Nutrition 101, and if you're really serious, a lot of people have had some great success with just getting back to the basics because we have the worst diet in the world eating over here, and all the foods and all the stuff that goes on, it's ridiculous. But if people are interested, we have it. Those are services that we want to include into our overall health system. We do offer oils and creams, CBD oils and some muscle creams if you need that stuff there. I have a huge room in my office that I've done yoga classes with and different type of meetings, nutrition classes. If anybody knows a yoga instructor or a massage therapist, and I'm not trying to step on Will, I'm looking for those people to come into my office. And so if you know anybody that on the outside that you're talking about that is looking for maybe some room to rent or needs a meeting room or something in the health field that would be great to dovetail into my business, I have plenty of room. I have a 2,000 square foot office that I need to utilize a little bit better. Okay, so so far any questions on basically your 2-day procedure of how the patient is entered into the office? Okay.
I have a question.
Yes.
You mentioned like the membership plan. Is that like you pay a certain amount a month and then you just go when you need to go, or?
Well, basically on my auto debit plan, what we normally do is once I've initially seen you as an acute patient, I mean you've come in, I've got a low back pain and I've helped you out, we put you on what we call a wellness plan or a wellness care. And for example, like there's an auto debit, we have a plan that's $87.50, you come in twice a month. Come in whenever you want. Normally it's like a gym membership. You use it or you lose it. Now I don't dock people if they don't use their visits. A lot of people say, I want to buy 10 visits or 20 visits or 15 visits. We do that also, and you just use those throughout the year whenever you want.
Yeah.
You're not going to lose them. But it gives you a little opportunity. One, you prepay it, but it gives you a little opportunity to save some money because they give you a discount. Otherwise, you just come in, you pay the retail price every time you walk in. But if you know that you're going to be doing this is something that works for you, and you get a result, and you know you're going to do this once a month, twice a month, 3 times a month, you might as well look into buying a package deal and having it either auto debited or pay for it at once. And I give you a small discount, but it's still, every little discount helps.
Yeah.
Okay, so I try to work with you on that. Before I was very stern when I first started. I did a high volume corrective work. It was 6 months of work for $2,000. You either sign it or you leave. It's real simple. In those days you can probably afford that and do that. Today it's almost impossible because even though you might have $2,000, people aren't willing to put that up at the front because they don't know what's going to happen tomorrow here. So that's a little unstable. So I try to work with you. If you have insurance, the only insurance I do take is a PPO that's qualified into our office. Usually PPOs will cover it unless they've done a third house, clearing house, and sold part of your benefits to another company. If that's the case, I can't help you out there. But if you have a PPO, we can, and again, cash and personal injury. Any questions on fees like that? Okay. All right. If you can switch the camera, I'm going to just show you a quick demonstration on what I do and how I do it. JT, if you can jump on the table for me. You look like the most celebrated here. We might be able to straighten you out once and for all.
Oh boy.
Oh man.
I don't know.
That's a tough word.
Yeah, we don't have enough time this morning.
I'm really hoping for this.
Sit on that table.
Look at it. Multiple.
Face down.
Yeah.
So these are my tools. Just like Norton came in with his beautiful truck the other day. These are my tools. My 2 hands on this table. That's all I need to do to work. So the patients in here, they are instructed to come into the treatment room. They lay down on the table. I assess them, and what I do is I'm checking their leg length by seeing how balanced their hip is. If I look at JT here and I bring him up here, I can see that his heels don't match up. Not that you guys can all see that, but he's off balance a little bit. Don't laugh, his hip is like this. Okay? So he's got a high left hip. And all I'm going to be doing is I come in here and structure determines your function. And I'm trying to balance you as best as possible. So my goal right now is to get JT's left hip as close as possible to even. Take some pressure off his mid-back and we'll adjust his neck. That's the fun part. The one thing I do want to say about the adjustment, people always say, oh, I went and got cracked today. Okay, we don't crack anything. I would not be able to get malpractice insurance if I cracked you, okay? So we adjust. It's an adjustment, it's a manipulation of the spine that releases a nitrous gas out of the joint that makes the popping noise. That's where you hear the crack from, okay? So we're not cracking anything, we're popping that nitrous gas. That's what makes the bone get out of place because of the way you mechanically move. It doesn't come back into normal position, it sits at an angle and then causes a bubble. When I come in there and push on you, it closes, it pops the bubble, brings the spine back into its neutral position so your body can function normally. When your body's like this or whatever it is, it's still going to function, but it's going to function with restriction on it. And we're trying to remove the restriction. We call that a subluxation. It just means a bone out of place, putting pressure on the nerve. All right, so then we assess, after I see that his hip is off, I'm assessing his mid-back to see how much spring he has, how tight he is, if there's any high or low spots in there. We'll feel some popping and clicking going on. I'm just trying to see what kind of spring he has, how much he moves or how much he doesn't move. Sometimes the patient I'll be able to see a sign, they'll yell, they'll jump, or do something. That kind of tells you you're in a tough area there. All right, I'll go from this side so you guys can see. All right, JT, take a deep breath in, blow it all the way out. Let's put a little pressure here on the spine here. Good. Do that again. Just relax there. Good.
Wow.
One more.
Is he okay?
He's breathing.
He's breathing.
John, say something.
Not here. So this is a real light adjustment. This is something really super easy. In the office, I use more of a hydraulic table. This is just a portable table. Just put anything flat I can use, but this is something that's pretty simple, just to kind of get his body back into normal, repositioning like the clay, so to speak. He'll go tear it up today, and we'll just do this again next week. But see, his hip is already starting to come down by just manipulating his hip and pushing down here. All right. It's pretty tight up in the shoulder area.
He's overworked.
Yeah, he works pretty hard.
That's from surfing.
Okay, JT, turn over on your back for me.
What?
That's
Roll over.
yeah, that's not good.
Yeah, when they don't respond, you kind of get worried a little bit. So you try to talk to them every once in a while and ask them a question. See if they're okay. All right, so we're just going to do a little, this is the funniest thing, my first year in practice, the doctor taught me, you need to pull his leg. I said, I didn't go to school for 7 years and spend $200,000 to pull someone's leg. Believe it or not, that's part of the move, okay? So what I'm doing to get that hip back down is I'm just simply distracting the leg that's attached to the hip to bring the hip back into place. When the patient is on the table and they're under no demand or gravity, it's really easy to put you in the perfect position. It's when you get up and start sitting down and walking and standing and driving and sleeping that you get into a weird position and start to have a muscle memory pattern that throws your structure off. Okay, relax this leg here. Let this one go. Good. So real simple, real easy. Nothing really difficult about it. This is probably the neck adjustment is probably the one that people freak out the most because it's not normal. Your body's under demand at all times in protective mode. When you're in a chiropractic office, you need to let go and just totally relax and trust the doctor that he's not going to break your neck, which you cannot do, obviously. The worst case scenario in a cervical adjustment is there's an artery there and you can get stroked out. It happens 1 in 5 million times. It happened in Anaheim probably 10 years ago. The guy did it himself by doing this. You ever see anybody doing this? This is the worst thing you could do, try and adjust your neck. Because you're now squeezing that artery that goes to your brain. And if by slight chance you happen to hit that artery just right, good night. All right.
Good night, John.
Everybody say goodbye to JT.
That's a great thing.
Okay, just relax here. Let it go. If you listen, relax. And it's real simple. It doesn't hurt. Adjustments don't hurt. It just freaks out. We'll let it go. Okay. So what we've done is we reduced the pressure in John's spine by realigning his hip, taking some pressure off his thoracic or torso, and then getting his cervical areas free so that the communication from the brain can work to the body today normally, or as best as possible. All right, John, let's give John a big hand.
There you stand, look at
How
that.
do you feel, John?
Oh, look, he's even walking. Yeah. So basically,
You won't fall over it.
Next.
yeah, next. When you're in the office visits aren't long, okay? You're coming in here to get adjusted and to get tuned up. Your visits, if you're coming on a regular basis, are probably from door to door, meaning, by the time you walk in the door to walk out the door, depending on what you need is about 15 minutes. Your first visit's about 45, your second visit's about 30 minutes, and then after that's about 15, 20 minutes if I don't talk. The adjustment itself took, 3-4 minutes, but I was talking in between. It's pretty simple. If we needed to ice or heat or put him on a roller table to relax him, we would do that, send him off. We already have his financials taken care of. We already have his schedule taken care of, so there's no paying, rescheduling, doing all this. We usually try to set that all up so that you can come and go through your life and your day the way you're supposed to. So hopefully there's a little insight of what I do and what we do. Any questions?
No.
Okay, thank you very much, everybody. Appreciate it.